Hello, I'm Dr. Robert Adams from Adams Chiropractic Neurology Group in Sonoma, California. I would like to talk briefly about the use of eye exercises for cervical and spinal rehabilitation. The paraspinal muscles are brother and sister to the eye muscles. For example, when we look at the spinal, this projection here from Netter, in this area of the brain stem, what we call the area acustica, cranial nerves 3, 4, and 6 up in the brainstem are integrated through this system in a pathway called the medial longitudinal fasciculus. From this area, the nerves go down to the paraspinal muscles. When we're talking about eye muscles, extraocular eye muscles, because this illustrates the extraocular eye muscles, and these are skeletal muscles, and they're coordinated through cranial nerves 3, 4, and 6, but they are actually embryological homologs, or brother and sister, to the paraspinal muscles in the low back area. If we look at the low back muscles and neck muscles, we see these muscles here are very similar to the cervical muscles, or sorry, the eye muscles. So this illustrates here a little bit more of a close-up of the neck muscles. We go right under the skull here. So we talk about the eyes, they move in a coupled fashion, or we call consensual eye movements, such that when I look to the left, my left eye looks to the left, my right eye looks to the left if everything's working normally, and vice versa. So looking to the left means that the eye muscle here, the medial rectus, is going to, or lateral rectus on the left is going to contract with the right medial rectus. So they work together and vice versa, right lateral rectus, left medial rectus. So here's two muscles on the different sides of the body which are hooked together, and they're hooked together in that midline pathway we described earlier, the medial longitudinal fasciculus in the neck, so that coordinates that activity. So the nerves that leave the spinal cord to the eye muscles are in a column with the nerves that leave the spinal cord to the neck muscles. And they're linked up through those pathways, the medial longitudinal fasciculus, and also the descending pathway, which would be the vestibulospinal pathway. So, meaning that if I look with my eyes, I can affect the tone of my neck muscles. So any of you watching this, if you'll just put your fingers on the back of your neck and feel right under your skull, push firmly, and then look up into the right or down into the left, up into the right, down into the left, you'll feel those neck muscles contract. So we can determine which muscles are weak in your eyes and which muscles are weak in your neck. And we can rehabilitate your neck, which will help your eyes, but also we can rehabilitate exercises, give you rehabilitative exercises for your eyes, which will help stabilize your spine and also increase activity appropriate in your nervous system. For example, if we determine that you have some decreased activation of your brain on the right side, upper brain, and your left cerebellum, we could give you specific eye exercises. Engaging your eyes, looking up into the left, for example, quickly would engage your right frontal eye fields and also engage your left cerebellum at the same time. Or, if we determine the eyes are weak, we have you looking down and to the right, slowly, which would engage your right frontal parietal area and your left cerebellum. So using these brain patterns and eye and neck muscle combinations can be very useful for rehabilitating a spine.